scene safe PPE. I'm going to call for extra EMS assistance. The mechanism of injury is a bar fight. I'm going to ask my partner to maintain manual stabilization of the C-spine. And I have one patient. My general impression is I have a 28-year-old male sitting, complaining of chest pain, and I'm going to categorize my patient into the sick category. For APU, I walk up to my patient doesn't register it, doesn't respond. I talk to my patient, hi, how are you? Hi, I'm not doing so well. My patient responds to verbal stimuli, so he's V on the APU scale. I'm going to get my patient's chief complaint. Why did you call 911 today? Chest pain. So my patient's chief complaint is chest pain. Okay, now I'm going to go to ABC. So for A, since my patient is speaking, I know he has to put in an airway, and I'm going to consider putting in an airway adjunct, but I'm not going to put it in now because my patient's airway is open. B, for breathing, I'm going to assess my patient's breathing and ventilation, and I'm looking for equal chest rise, and I'm also looking at my patient's respiratory rate, and my patient's respiratory rate is 24 and shallow. So with that, I'm going to give my patient 15 liters of high flow oxygen through a non-nut rebreather mask. And I'm going to look for any injuries that may compromise my patient's breathing, but I don't see any. So now moving on to C, I'm checking the pulse of my patient, which is 98. I'm also checking the skin of my patient. I'm looking for color, temperature, and condition. And I see my patient's skin is pale, cold, and clammy. I'm going to treat my patient for shock, and I'm looking for any major bleeding, and I don't see it. So my patient is a high priority patient and needs rapid transport. Next, I'm going to ask my partner to take my patient's vital signs, and that includes blood pressure, pulse, and respiratory rate. And while my partner does that, I'm going to go through sample. So, what symptoms are you experiencing? My patient's puncture wound lower rib. Do you have any allergies? No. Are you on any medication? No. Has this ever happened before? Do you have a history of this? No. What was the last thing you ate? Just had 4 beers and peppers. What were the events leading up to this? Visiting an old classmate, and her boyfriend came in and started a fight. He stabbed me. Wow. What was the onset of this? Got stabbed. Does anything make this pain feel worse or better? Hurts to breathe. What's the quality of this pain? Sharp stabbing pain at trauma site. Does the pain spread anywhere? Do you feel it anywhere else? No. On a scale of 1 to 10, 10 being it hurts a lot, 1 being it doesn't hurt at all, how would you rate this pain? 6 and respiratory distress of 4. How long has this been going on for? 15 minutes. Now that I obtained my sample and OPQRST, I'm going to move on to the secondary assessment. So first, I'm assessing my patient's head, looking in the ears, eyes, nose, mouth, and I'm checking for BTLS. Then I'm checking my patient's thorax and making sure it's in line. I'm also looking for jugular vein distension. I'm also checking the cervical spine, and the whole time I'm checking for decap BTLS. Next, assessing the chest and inspecting the chest. I'm also going to listen for lung sounds. Okay. Next, I'm going to palpate all 4 quadrants of the abdomen, checking for decap BTLS. Okay, next, I'm going to flip my patient over and check the spine. I'm also going to check the pelvis and go in and down, and I'm going to verbally assess the genitalia. Next, I'm palpating the legs and arms, and on each leg and arm, I'm checking for pulse, motor, sensory. So, pulse, motor, can you move? And sensory, can you feel this? Pulse, motor, can you move? And sensory, do you feel this? Pulse, motor, can you move? Sensory, can you feel this? Pulse, motor, can you move? Sensory, can you feel this? So, through my secondary assessment, I found in the right lower ribs punctured round with minimal bleeding. So to treat that, first I'm going to apply pressure with my gloved hand, and then I'm going to treat that injury with an occlusive dressing. Next, I'm going to treat any secondary injuries, but I didn't see any, and I'm going to reassess my patient every 5 minutes.